Good morning. I'm Senator Henry Stern. I represent San Fernando Valley, Los Angeles. I'm a Ventura County. Here with my colleague, Carolyn Menjivar. We share big stretches of LA together. And we're here with some of the both leading experts in the state, but also the directly impacted by those with mental health crises in their lives. This is not just people living on the streets who are anonymous people. These are our sons and daughters, our brothers and sisters. And life can be very normal until it isn't. And things can come up later in life, and suddenly you're relying on a system to help fill gaps for a loved one who is having such severe mental illness that they're in a position where committing a crime, living unsheltered, harming yourself, exposing yourself to harm, the basic functions that people sort of take for granted when you're well, to look after your own safety, are lost because of schizophrenia, acute psychotic affective disorders. We see people on the street corners talking to themselves, and we walk right by. Every one of those persons is somebody's son or daughter or brother or sister. And right now there's gaps in the system, and that's why Senator Menjivar and I have been working to make sure that the thousands of people in Los Angeles, and even more than that across the state of California, who are currently slipping through the cracks in our system, are getting access to treatment, especially when they're arrested for a misdemeanor or a felony, that the system doesn't simply just spit you in and out and recycle you endlessly. Wrote a bill a few years back that became law in California that allowed for us to divert more people suffering severe mental illness found incompetent to stand trial. In other words, not to represent themselves in the courtroom. We wrote a bill to allow those people to find treatment instead of sitting in jail, because we all know that jail is probably the worst place to get mental health care. But the only place worse than that is no place at all and on the street. And these folks now are at alarming rates having their cases dismissed, thanks to the law I helped write, and back on the streets without care. In our county alone, despite the best efforts of our Office of Diversion and Reentry and of all the innovative mental health care programs, we have over 1,500 people a year having their cases dismissed, and they are severely mentally ill. They've committed a misdemeanor, and they have some kind of psychotic affective disorder or schizophrenia, and they're back on the streets without care and recommitting offenses at twice the rate they were before we passed this law. So we have to fix these issues and not make dismissal and sort of washing your hands of folks the first option. I'm really proud to be from LA County, where they're doing very creative work around this. Senator Menjivar and I had the opportunity to tour the Twin Towers, which is for the most severely mentally ill people in the LA County region who are in jail, and watch some of the path-breaking techniques that are being used to get people care. We have some of those leaders here with us today, people who have delivered that mental health care in jail for people who are hurting. And what we've learned is that being on your meds helps, having people around you helps, being left alone to your own devices when you're suffering a mental health crisis does not help. Suicide rates show it, the recidivism rates show it, the homelessness crisis at its most acute on the very edge, not the housing part, but the part where people are literally sleeping on cardboard. And Dr. Parvtovi, who's a street doctor in LA, will tell you how she distinguishes between people who need a helping hand in housing and someone who's off their medication and suffering from severe mental illness, where it's an entirely different puzzle. But in LA County, look, we're trying, and I applaud what the Board of Supervisors and the mayor are trying to do in terms of putting care first, but we know that we can't just sit back and let this happen. And when we have over 5 people a day leaving jail and wandering off outside of care back onto the street, we're not serving those people, we're leaving them behind. So my hope is that SB 1400 helps fill some of those gaps, And Senator Menjivar is going to talk about the other bill we're authoring together, SB 1323, about similarly situated people who commit felonies. So, Senator Menjivar, you want to step up for a sec?
Absolutely. Thank you, Senator. Good morning, everyone. As you heard, I'm the neighboring senator of the San Fernando Valley, Senator Caroline Menjivar. Senator Stern and I have been working in this space, well, me now 2 years, him a little bit longer. And I'm so happy to have my neighboring senator focus on these kind of issues. LA County and a little bit of Ventura County have two senators who are really pushing this forward. You've heard from the senator that just last month we took a tour in LA County with leaders, other legislators from across the state. Even the pro tem joined us in the tour. We got to sit in a court hearing proceeding. We got to take a tour of the Twin Towers, and we saw firsthand that unfortunately the only place you get treatment is if you get arrested in our jails, in our prison. Sure, at least we're giving treatment there, but that should not be where people need to end up to get treatment, where they need to be praying that if I get arrested, then I will get some medication. I saw firsthand the different creative ways that people are getting individuals to take their meds. Conversations regarding how we need to adjust what kind of medications we give individuals. The monthly ejection seemed a better route to take when we're talking about individuals that sometimes are hard to find on the streets, that need a little bit more consistent medication. We must do better to change the cycling of individuals in and out of jails and prison with no sustainable changes or impacts to their lives. What we're doing right now is not working. And what I'm looking to do with SB 1323 is change the felony aspect, the fist, if you will, of this population. What we're seeing is about 10%, approximately 10% of individuals who are under felonies with an incompetent to stand trial are never going to be competent to stand trial. We're talking about individuals with dementia, schizophrenia, Alzheimer's. It'll be very difficult to become competent again. And what we're doing is having them wait in jails for weeks, sometimes months at a time, for no reason, because we'll send them to a state hospital that is overburdened and they'll never be able to become competent. SB 1323 is looking to give some flexibility to our judges who are already being very creative in diversion. But for FIST, they have no option. They have to send them through this process. We're wasting our tax dollars, and it's not in the name of justice for that individual or the felony that was committed. And I want to be very, very clear. We're talking about non-violent felonies. There's a long list of exemptions that you can read on the analysis of the bill. But these are individuals that need other options, whether that's care court, whether that's conservatorship, whether that's another mental health illness, whether that's the buildings and beds we're going to build, hopefully with Prop 1 dollars. We want to ensure that 10%, which may seem a little low for you, but when we're talking about the bottleneck that is being created where people don't have a bed to sleep, 10% is a lot. And also when we're talking about the workforce shortage that this behavioral sector is facing right now, 10% is a lot. We want to make sure that they're not waiting in places like Twin Tower for a very long time. So through my work as chair of the Senate Budget Subcommittee on Health and Human Services, through conversations with stakeholders, we looked at the recommendations that were brought down from the committee on the revision of the penal code and other expert panels to modernize our incompetent to stand trial process. And SB 1323 is one important step we can take now to improve outcomes in our criminal justice system. At the end of the day, we want to make sure that we're addressing the needs of the individual, because what we're seeing is the core occurring illnesses are not being treated. And I'm so glad that we have leaders that are looking to combine the behavioral and physical health needs of the individual and not looking at them as silos, because this will continue to keep them in the destabilized cycle of incarceration or hospitalization that is occupying all the beds that we need necessary for other treatment. SB 1323 is coming up. As we know, we have a week and a half left. For this bill to come up for a vote on the assembly floor. It's enjoyed bipartisan support. It has almost at this point no opposition because we worked very, very hard to ensure we worked with everybody to get to the sweet spot. And the sweet spot is that we need diversion. The sweet spot is that we need to treat these individuals. The sweet spot is that we can't just put them back on the street and see them cycling in and out again of incarceration. So thank you, Senator Stern, Senator Eggman, and everyone else who's doing work in this space to think about the individuals, to think about stopping the cycle of in and out incarceration. And I call on the Assembly to vote SB 1323 out of the House. Let's get it to the governor to change the incompetent to stand trial process. Thank you.
Well, thank you, Senator. Next up, I want to bring a practitioner from the field who's worked in both our county and as well as up in a rural county now in Butte County doing inpatient care. She was the supervising psychiatrist, though, at Twin Towers, which we toured. And I think you'll find her insights interesting. Dr. Wood got her PhD in neuroscience at Johns Hopkins, but then completed her adult and children training at the UCLA Semel Neuropsychiatric Institute. And really her specialty is for people with neurodevelopmental disorders, severe chronic mental illness, and treating people who are often forgotten. So, Dr. Wood, hoping for your insights here. Thank you.
Thanks, Senator Stern. I also got an MD at Johns Hopkins, so I am a real doctor, a physician. I'm a psychiatrist. So I want to tell you about an experience. I'm talking to my patient, John, through an enforced glass window. John is naked, it is cold, his clothes are stuffed in the toilet, and there are ripped up pieces of food and containers and remnants spread across the floor. I introduce myself and offer to discuss his mental health and treatment options. He says, I'm fine, I don't take medication. Before he's distracted again by the voices and his face goes blank. I attempt to re-engage. I say, you took medication when you were here before and it seemed to help. But he has already turned away to head back to his concrete bunk. Over the next few minutes, while I attempt to engage again, I see him talking to himself at the other end of the cell. John is a middle-aged man with schizophrenia who committed a misdemeanor. Under a 2022 change in California law by Senator Stern, I, as his doctor, am powerless to provide him or others like him with the treatment he desperately needs. Like thousands of others, unless we make a change, he will continue to cycle through the jail to street pipeline that flows from our broken mental health care system. In 2018, 2022, and today, with the bills that are being discussed right here, right now, California has taken major steps away from the broken, incompetent to stand trial system by creating pathways for defendants with serious mental illness to be more easily diverted into mental health programs. Senator Stern's legislation that went into effect in 2022 appropriately moved us away from equating the legal system's process of restoring competency with mental health care. And for a group of very mentally ill individuals, it also widened the system level cracks to fall through. While involuntary medication orders are still obtainable for a defendant who is found incompetent to stand trial for a felony, counties are no longer allowed to provide care for the defendants with misdemeanor charges, often the most severely mentally ill, once they refuse. This means that a patient's treatment is dependent upon the type of offense instead of medical necessity. Since the patient's symptoms are no different if they were charged with a misdemeanor or a felony, their treatment should not differ. Since 2015, Los Angeles County has diverted 3,500 individuals from the jails into community programs. In 2021, the rate of rearrest within 6 months was 15.9%. But in 2022 to 23, the 6-month rearrest rate doubled to 31.4%. Additionally, over the last year, the percentage of misdemeanor incompetent to stand trial referrals accepted by LA County diversion programs declined by 10 to 15%. Less care, more suffering, more crime. For my patient John, it took 5 weeks to be declared misdemeanor incompetent to stand trial. His case was then automatically referred to diversion, which took 3 weeks to determine that John was not suitable for any of their programs because his symptoms were too acute for their level of care. By that point, John had been in a jail cell by himself for over 2 months without treatment. He was coaxed out to shower and move cells once. Since he expressed opposition towards the deputies when they didn't take him back to his cell, he was deemed hostile and no further attempts were made to bring him out for programming. So far, keeping John in jail without treatment only made him less able to engage in his own care. Now that the state has billions in new funding from Prop 1, we can adopt models similar to Miami-Dade County and prevent people from ever ending up in jail in the first place. In Miami, with a combination of pre- and post-booking diversion systems, mentally ill individuals are diverted early and linked with supports. Between 2007 and 2017, the annual number of jail bookings and average daily population of the Miami-Dade jail were both halved, and the annual recidivism rate for diverted individuals dropped from 75 to 20%. We can do this in California. Of course, questions around involuntary medical care present ethical quandaries. At the same time, it is absolutely unacceptable to continue to use our jails as de facto mental health institutions and detain ill people without providing the necessary medical treatment and then release them even more vulnerable than before. I'm watching people deteriorate in jail so that they can die with their rights on in the streets. By allowing us to treat the most severe cases by including the possibility of involuntary medication orders for misdemeanor defendants, Senator Stern has a chance to remedy the law and get some of the most vulnerable people in our care the help they are currently lacking. We need to keep moving forward and get away from using the incompetent to stand trial system as a way to treat mental health. But until we can fully do that, we need to do the best we can with the system we've got. Thanks.
Thank you, Dr. Wood. Next up, someone else who's served within the system and outside of the system, Dr. Susan Parvtovi, who currently is a board-certified family physician and addiction medicine specialist. She's been practicing homeless medicine for over 20 years, and she's the co-founder of the Grave Disability Working Group, which is an expert group of clinicians, family members, boots-on-the-ground workers, and researchers who advocate for quality care for all those who suffer from severe mental illness and grave disability. She was an LA County women's jail doctor, and she recently published a book called Renegade MD, A Doctor's Story from the Streets. Dr. Parvtovi.
Thank you. I'm the short one here. Hi.
Can you all see okay? Do you want to? You might be behind that.
I think I just deleted my
I'm going to help you get it back. I can undo it.
right here. Okay, got
You
it.
good? I would just put it here a tiny bit so they can see you.
Okay. Thank you. Hold the mic down. Got it.
There we go. Let's see one more time. You're good. Okay, you're going to be good.
Thank you.
Yeah.
Thanks for having me. It's such an honor to be next to Senator Stern and Senator Menjivar. My name is Dr. Susan Parvtovi. As Senator Stern said, I'm board certified in family medicine and addiction medicine, and I specialize in street medicine. I helped start the first street medicine team in LA County, and I've been working with substance using unhoused for over 20 years. It wasn't until I started seeing patients in the streets did my heart really start breaking for the myriads of those suffering from severe mental illness living in the streets. They were covered in filthy, infested, ridden clothes, often inappropriate for the weather, ignoring their severe medical conditions and suffering from delusions, hallucinations, and paranoia. I thought that was the worst our society could suffer from, until I started working at the LA County jails, specifically the women's jail. I was a primary care physician there, and I started working with the high observational housing mental health staff, caring for the sickest of the sick. They could request me to round on their people that they were medically worried about. I'll tell you about one of the first patients I met. We're going to call her Carrie. Each inmate in the high observational housing are in single cells with a window to look out and we can look into. I saw this thin, frail, naked woman. Sounds like a common scenario, right? behind this muddied glass. And they brought me up there because she wasn't eating, she wasn't drinking liquids. But this wasn't muddied glass. She had smeared feces all over the window and all over herself. It smelled horrendous. She was muttering to herself, not responding to me. We decided she was our number one, which meant she was first on the list to go to the inpatient hospital, where the doctor is allowed to medicate someone involuntarily as a medical necessity. You see, when someone is in a car accident and bleeding profusely, we don't wait to ask if we have permission to treat them. We just do so because it's a medical emergency. When someone is in the full throes of psychosis, it's a medical emergency. Now, it usually takes weeks to get a bed in the inpatient psychiatric hospital, which is why we need to allow the doctors to take care of their patients who are misdemeanors, incompetent to stand trial when they are psychotic, because it's a medical emergency. This is called an involuntary medical order, which is what Senator Stern is proposing to include in his new bill. I also want to tell you about Melvin, who's given me permission to tell his story. I had taken care of Melvin for 9 years in my Skid Row clinic at the Center for Harm Reduction, which is a needle exchange. There, my team and I would care for his wounds due to injection drug use and treat people with medication-assisted treatment for substance use as outpatients. Melvin was on the streets of Skid Row, in and out of jail, using heroin. Like most, he switched to using fentanyl and methamphetamine. And like many, he developed schizophrenia spectrum disorder from his meth use. I was able to treat him for his psychosis with long-acting injectable antipsychotics, but he continued to use fentanyl and meth. And at some point, he was incarcerated. And because he was medicated, he was able to accept a diversion program in LA instead of jail time. While in the program, he continued to see me at the clinic for his mental health issues, but was overdosing 2 to 3 times a week. That's super serious. The program made the decision to give him the direction that he was to enter a 90-day rehab or return to jail. They knew him. They knew he wanted to be healthier. And at first he told me he wasn't ready to get off fentanyl, but he would do the program. Much to my surprise, at the end of the 90 days, he wanted to stay clean. A year later, he is clean, about to graduate the program, and about to enter his own supported housing situation. This is an example of the promises of diversion. Treat, don't incarcerate. Thank you.
Thank you for giving us a little bit of good news. Ms. Hopper is up next, who is a advocate and a volunteer for NAMI here in Sacramento and advocates of individuals with serious mental illness, but she's also a family advocate for her daughter. So, Ms. Hopper, thank you for the courage to share your story today. Let's push that down a little more. All right. Let's see if this works for you.
Thank you, Senator Stern, and all the people that have made it possible to bring this bill to our attention. I'm especially thankful to be invited here today because families are often excluded from these kinds of conversations. My daughter, age 35, has lived for months at a time with untreated symptoms of serious brain illnesses called schizoaffective disorder, epilepsy, and substance use disorder. There have been other times when she manages her condition quite well. During the spells of non-treatment, my daughter struggles to retain housing, to provide for her own daily needs, to follow respectful rules of society and laws, and has behaviors that have led to citations, misdemeanors, and eventually to the current felony charge and being deemed incompetent to stand trial. After several years of being afforded opportunities in the community, these opportunities were not a strong enough support system for her, and at this moment in time, she's residing in psychiatric hospital setting, awaiting an assessment for competency. So the system is progressing along, but she does fall into the category of the 10% described by the senator, where SB 1323 is attempting to address those needs. I want to tell you more about my daughter. When she is not engaging in treatments, her brain is impaired and does not function logically. Instead, her symptomatic brain keeps her captive in a locked in an altered reality, and she has no key to free herself. She is imprisoned in her own unwell brain, and treatment is the key to her return to this reality. She rarely recalls all the things she does during these relapses, and she has regrets for behaviors that she would never do when she is in her right mind. She desires to be productive, to be well, to sustain recovery, and she does not like being ill. She reminds me that she did not choose these illnesses. Each time she is engaged in treatment, voluntarily and occasionally involuntarily, she emerges and enjoys her freedom and is a responsible citizen. These treatments have included medications when indicated, as well as talk therapies, behavior modifications, classes in life skills, and supportive housing. In other words, it's whole person care, and it's individualized care treatment in a planning process that she participates in the creation of. I'm thankful that she chooses me to be on her support team, but it is not always easy. One of the hardest questions I have ever faced while walking this journey alongside my daughter is when she has once again engaged in treatment and is emerging out of symptoms of deep depression, paranoia, and hallucinations of sight, sound, and smell. And she asks me this big question: why didn't someone do something to help me sooner? And I reply, we tried everything allowed by law, and I am so sorry it wasn't enough. And then I meet with other families like mine, and we advocate for better laws to deliver treatment to our loved ones who have become, at no fault to themselves, the hardest to reach and treat. We join together, setting aside our frustrations and our heartbreaks, to ensure that our loved ones have the right to treatment, not tragedy, for these biological brain illnesses. As a family supporter, I know the value of appreciating that success looks different for each person, especially for people like my daughter, whose outcomes need to be measured differently. She is not to be blamed or shamed by others who have already attained full recovery. She needs and deserves more assistance and treatment engagement tools than what others may need. SB 1400 and SB 1323 are examples of ways to meet the treatment needs of those who struggle most and have become justice involved. If SB 1400 had been in place before my daughter's current situation, I feel confident that the delivery of treatment would have prevented her current felony incompetent to stand trial situation. SB 1323 ensures she will receive the right treatment due to the right assessments, which is the key to her return to freedom from her symptoms. I encourage people here to support both of these vital bills because they are the keys to individualized treatment that can prevent recidivism, reduce costs, and reduce human suffering. This is what families like mine ask for support for. Thank you.
Thank you, Ms. Hopper, Mrs. Hopper, and Mr. Hopper, too, who's here supporting her and his daughter. We know it takes a family and those who don't have parents that are warriors for them. You're speaking for them, too. I'll just wrap up by saying that when you legislate, sometimes there's a tendency to presume that everything you do is exactly right, and a wariness of saying, I didn't get that right. I need to fix some things. In this case, I wrote that law in a way that is leaving the Hopper's kid behind, and thousands more across the state of California behind, in the cracks. It did a lot of good too. It's pushing a lot of people from the worst places on earth in jail into care, but so many are not in care, and you see them every day, and we're starting to turn our backs on them as Californians because we've just had it, and we start to other people and say that's just, it's like you start to look at people as less than human. That has to end, and we have to take full responsibility. And I'm confident that if we can move our legislation forward through the Assembly, that will give not just LA County the tools to solve this, or not just Sacramento County the tools to solve this, and they happen to have great mental health courts and judges and district attorneys willing to engage on these issues, and leaders of their boards willing to say yes, but everybody. It can't just be an excuse to say this person doesn't want the care, doesn't want treatment, and so we're going to let them waste away in a jail cell. That doesn't work in the state of California. So as important as the public safety measures have been that we've pushed forward in the past weeks, the governor recently signed on retail theft, on fentanyl issues. We know those are critical, and I supported all of them. But what I'll say is that unless we address this mental health crisis occurring on our streets and in our jails, we have not solved the public safety issue this legislative session. So we feel like this is indispensable work to pass these bills. And I encourage all my colleagues in the Assembly. We've had very good support from the Chair of Public Safety thus far, Kevin McCarty, your own Sacramento Senator. And he's been excellent on these issues, so I do want to applaud him as well. But we're confident this is tricky stuff. And so thanks for being with us today. I'm happy to take any questions. Yeah. Yep. Yeah. So the question, just to repeat for those who weren't tuned in, it was a question about there's not a budget item, there's not an appropriation attached to our legislation to provide alternatives to jail-based care. Yes, we're going to be building the largest ever build out of behavioral health treatment in California under Proposition 1. So that's absolutely part of the calculus. Is we can reach further and try to do more and deliver better care both in and out of jail because the money's coming and California expects that money to be spent quickly, but with accountability. So that's certainly anticipated, but in the technicalities of the bill itself, this is just the restriction of the ability for a judge and for a DA to just simply dismiss a case without at least pursuing care options. It doesn't say you have to divert them into a behavioral health treatment, but what's happening right now under SB 317, the prior law, is that DAs are working with their public defenders and just automatically dismissing cases without actually going through the deep diligence to get folks into either a psychiatric hospital, an inpatient facility, outpatient, assisted outpatient. It takes a special kind of judge to follow through on that. We know there are some rock stars, but a lot of this does come back to like building the judiciary to a place where everyone can have these kind of thriving mental health courts that can handhold people through, with the caveat that there's no way to get people through if they're off their meds. If you just voluntarily say, hey, would you love to be in a psychiatric facility to someone who's already been deemed incompetent to stand trial, who already literally cannot represent by law their own interests in court, ask them any question and it's going to be a tricky answer. So that's the medication piece. So in theory, this is just, in other words, authorization, not mandate. Allowing things to say go into the care court system, which is a big priority for the governor, which I'm very supportive of, saying if you're a misdefendant, you might be a great candidate for care court, but we're really sort of prompting that issue at the county level and saying you've got to consider those options. You can't just default to dismissal. Any other questions? All right. Thank you, Dr. Wood, Dr. Parvtovi, Kaino, for being here, and to all my colleagues out there helping support our legislation, my joint authors. We do appreciate you. And I don't know if you want to come up now and take a photo for the archives before we wrap. All right, and then we'll wrap. Okay, thanks all.